Depression is a severe mental illness characterized by persistent low mood that interferes with one's day-to-day activities. Yes, children can have sadness for a prolonged duration of time, that is more than 2 weeks, and in an intense way that may interfere with how they play with their friends, interact with their siblings and other family members, or affects their schoolwork. Depression may also affect their growth and development, and emotionally and physically. In developed countries, where there is easier access to healthcare and more knowledge on mental illness, it is estimated that 3% of children and 8% of adolescents suffer depression. Depression is often undiagnosed and untreated because we assume it is the usual mood swings in child and adolescent development. When the symptoms listed below persist beyond 2 weeks and seem to affect the child's day-to-day activities, it is advisable to seek the advice of a doctor. So the following are the symptoms that, as a parent or a guardian, you should look out for in a child who is most likely to develop depression. Acting out, tantrums or angry behavior, sadness or low mood that is persistent. Your child suddenly or progressively withdraws from friends and prefers to stay alone most of the time, which isn't in keeping with their personality. Appetite changes, thereby eating too little or too much. Sleep changes, evidenced by sleeping too much or too little. Crying a lot or verbal outbursts. Difficulty concentrating in their schoolwork, which may be noted as a drop in academic performance. Saying they are always tired and cannot do simple tasks that they previously did. This may be wrongly interpreted as laziness. It is therefore important to rule out a physical illness too. Recurring physical complaints that have been investigated with no identifiable medical cause, commonly headaches and stomach aches. Thoughts of death or taking their own life. Feeling excessively guilty for their mistakes even when they pass. Depression has been shown to be the major cause of disability among adolescents by the World Health Organization. You may be put off seeking help for your child because of the social stigma associated with mental illnesses or fear the medication. There is no harm in making a consultation and making an informed decision afterwards, because when you ignore your child's depression, they may be unable to perform optimally in their academics, or your child could face problems in their social life that would in turn worsen their emotional development due to being misunderstood by their peers, teachers, or any other acquaintances. And this is because they may exhibit behavioral symptoms like always being angry, verbal outbursts, fighting, or completely avoid social interaction. They may turn to drugs of abuse or alcohol as they approach teenagehood. So life events like death of a loved one, relocating to a new environment, or parental conflict, parental depression, physical health problems like long-term illnesses, disturbances of the chemicals in the brain, genetic vulnerability, which we can all do nothing about it, having a biological relative that suffers depression should instead make the parent or guardian more vigilant and keen in picking up symptoms early and seeking the necessary assistance. So you should ensure that the child's environment is not chaotic. You should try to minimize any family conflicts as much as possible, whether verbal, physical, or non-verbal in the home. Have structured routines for the child. Keep children away from substances including alcohol, cigarettes, cannabis, and so on. So, a detailed history of the symptoms will be taken by your doctor. The psychiatrist will thereafter conduct a full physical examination of your child. You may be sent to the laboratory or radiology department for tests if the doctor feels he or she needs to rule out a physical reason for your child's symptoms first. The doctor may request to talk to your child alone. And also, a mental state examination is carried out by a series of questions and keen observation while in the consultation room. It's also advisable to allow your child to be him or herself, to allow them to speak their mind. You may be requested as a parent to fill in one or several forms or questionnaires. These are filled in by a parent or guardian, teachers, and the child or teenager, him or herself, if they are of age. Friends, classmates, siblings, and nannies may also be interviewed to gain a better picture of the problem. The questionnaires also help rule out other conditions that may mimic or be present together with depression, like attention deficit hyperactivity disorder, conduct disorder, anxiety, among others. So it's good to know there is no specific laboratory test or X-ray that can confirm depression. Once the diagnosis is confirmed, the doctor will recommend a specific type of talk therapy, that is psychotherapy or counseling. This may be adequate, or he or she may also recommend a combination with medication, that is antidepressants, which are rarely used in children but are important when recommended by a qualified mental health worker. There are types that are approved internationally for use in children. You may also be referred as parents or guardians for parent management training. So depression, when diagnosed and treated early, may completely subside within several months. There is also a chance of recurrence later on in life. So close monitoring and awareness by both the child as they grow and their parent is very beneficial. Many depressive symptoms, like I mentioned earlier, that is preferring to stay alone by isolating themselves from family and friends, talking of hopelessness, helplessness, or wanting to die, increased reckless behavior, or being uncontrollable, especially towards teenage years, frequent accidents, giving away their personal belongings like toys, books, clothes, etc., crying a lot or reduced emotional expression, always focusing on negative themes in their artwork drawings, poetry, compositions, stories, or comments in conversations, starting to use alcohol or other substances, researching on the internet or from books on methods of suicide. So it's good to always seek help from a nearest children's hospital, and you'll be assisted by any healthcare worker on how to see a mental health professional, because depression is a common illness and it is treatable. Thank you for watching. Stay tuned to stay informed. Subscribe. See you in the next one.